All right, welcome back, everyone. We're now turning to a very difficult story making headlines across the country. Lindsay Clancy, a 32-year-old labor and delivery nurse at Massachusetts General Hospital, is being charged with killing her 3 children, the youngest just 7 months old.
And there are so many unanswered questions, and obviously this is heart-wrenching that this happened, Dr. Jen. But let's talk about the difference between postpartum depression and postpartum psychosis, because they are completely different.
They're completely different, and we have to first start, you guys, by saying this is the most tragic but the most clear example of mental illness in postpartum psychosis. So let's go through the difference, because they're not really on a spectrum, right? They are night and day. Number one, postpartum depression, we've talked about it, incredibly common, thought to affect, 10 to 20% of women giving birth in this country. It includes highs and lows emotionally, fatigue, a sense of guilt, anxiety, difficulty caring for that woman herself or the baby. And again, very, very common, 1 in 7, and oftentimes treated initially with medication, but then support therapy, talk therapy. Postpartum psychosis, the definition of psychosis, you guys, is impaired reality testing, impaired judgment and insight. This can involve psychotic symptoms like delusions, auditory or visual hallucinations. We think that those with bipolar disorder or schizophrenia are at higher risk. And I want to be crystal clear, this is considered a medical emergency. If any woman is experiencing any of these symptoms, or you think that you are near a woman who's experiencing those symptoms, she needs to be brought to an emergency room in some cases, and support and safety needs to be priority number one, both for the baby or any other children, as well as for that woman.
Are the signs easy to miss?
For postpartum depression, I've seen that in my 22 years of being a practicing physician hundreds and hundreds of times. That's a woman who's tearful, and that's not subtle. When you are with someone who is psychotic, that is absolutely not difficult to miss, you guys. It is oftentimes frightening for the person who's observing it. Trust your instincts. Get help. This is not something you fix or support on your own.
But as common as postpartum depression is, it is not a risk factor for psychosis, right?
It's really not. They're separate. And postpartum psychosis, much, much more rare, 1 in 500 to 1 in 1,000. But it starts acutely in days and weeks following delivery. Postpartum depression starts much later. Usually, we're talking weeks, months, or even later in that first postpartum.
As soon as you spot it, get help right away.
100%. And this, again, this is mental illness 101 that we're seeing here, and it is a tragic story.
Yeah, and if you don't feel comfortable calling your doctor or telling someone you love, or if you or someone you know is struggling with thoughts of suicide, there is free confidential help. It's available 24 hours a day, 7 days a week. All you have to do is call or text the National Lifeline. That number is 988. You are not on your own with this.
There is help out there for you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.